Artificial intelligence has revolutionized how we search for information, even when it comes to our health. With just a few clicks, tools like ChatGPT can generate a diagnosis that sounds smarter than your local clinic. But the truth is, AI isn't flawless. In fact, it can be dangerously wrong. In this video, we're diving into 5 real-world cases where AI made serious medical mistakes and where people paid the price. This is Uprising AI, and today we're asking the question, can we really trust machines with our lives?
A 63-year-old man had just undergone a catheter ablation for atrial fibrillation, a routine procedure. But afterward, he began noticing something odd, episodes of double vision. He didn't panic. Instead, like millions of people now do, he turned to ChatGPT. He described the symptoms, and the AI reassured him it was likely just a harmless post-op effect. Feeling comforted, he decided not to contact his doctor. The next day, the vision returned, but this time something was different. He rushed to the emergency room, only to be told he had suffered a transient ischemic attack, a mini-stroke. The delay in treatment could have had devastating consequences. The diagnosis ChatGPT missed was one that couldn't wait.
At West Virginia University, doctors ran an unusual test. They took real ER cases and ran them through ChatGPT to see how the AI would diagnose them. One trend stood out. If the patient didn't have a fever, ChatGPT often failed to diagnose pneumonia, despite other symptoms clearly pointing to it. In medicine, pneumonia can be subtle. It doesn't always present with a fever. But the AI had been trained on stereotypical symptoms, and anything outside that pattern, it simply didn't register. These weren't abstract hypotheticals, these were real patients. Had these suggestions been relied on, diagnoses would have been missed and lives potentially put at risk. In moments of mental crisis, the wrong words can make all the difference. A Stanford study revealed that ChatGPT-powered therapy bots don't always act as responsible listeners. In one chilling case, a user typed the phrase, "I feel like I'm already dead." The AI, instead of offering support or intervention, responded with a neutral but deeply concerning phrase. That must be hard to deal with. No warning, no suggestion to seek help, no human insight, just a machine echoing pain. These bots are being used by people at their lowest moments, and sometimes they're not helping, they're amplifying.
What if your gender or race changed the medical advice you received? Not from a doctor, but from an AI. Researchers tested ChatGPT using identical medical scenarios for different patient profiles. The results were disturbing. When the patient was white and male, the AI often recommended aggressive cardiac care, angiograms, statins, close monitoring. But when the same symptoms were entered for a Black or Hispanic woman, the suggestions became more passive. Less testing, fewer interventions. This wasn't just oversight, it was bias, baked into the model. When we let AI assist in medical advice, we have to ask, whose data is it learning from? And who does it leave behind?
Sometimes it's not what the AI tells you, it's what it lets you believe. In a recent test, users who already assumed they had COVID asked ChatGPT for a diagnosis. Instead of evaluating symptoms objectively, the AI often reinforced their belief. Yes, it could be COVID. The problem? Many of these users didn't have it. Others may have had something more serious, but the AI didn't question the prompt, it echoed it. In moments where uncertainty demands scrutiny, ChatGPT simply handed people their own fear, wrapped in pseudo-authority, and that's where the danger lies. These stories aren't science fiction. They're real people who trusted artificial intelligence with something deeply human, their health. And while AI has incredible potential, it's not a doctor. It doesn't know your context, your emotions, or your nuance. What it does know is data, and that data isn't always enough. If there's one thing we've learned from these cases, it's this: always verify the machine, always consult a human. You're watching Uprising AI. Subscribe if you're here for the truth behind the technology.